Run your tongue across the roof of your mouth right now. If it drags instead of glides, your body has been signaling you for months and you've been drinking it away with a glass of water. Here's what almost nobody knows. Dry mouth isn't one condition. There are 6 different types, and each one is your body pointing at a completely different problem. One points at your blood sugar, one at your kidneys, one at your oxygen dropping overnight, one at your nervous system failing. They feel almost identical when you wake up, but the warning behind each one is entirely different, and treating the wrong one wastes years. 69-year-old man, my ER, came in with chest pain. Routine workup. I asked him one question 4 doctors in 2 years never asked. Do you wake up with dry mouth? Every single morning, he said. Told all of them. All 3 said drink more water and buy a humidifier. I ran the tests, none of them ordered. His overnight oxygen was crashing to 81%. His kidney filtration had been sliding for 18 months. His fasting glucose was pre-diabetic. 0 symptoms on any standard panel, except the one warning he'd reported to every doctor who threw it in the trash. That's not a nuisance. That's a distress signal firing before pain, before fatigue, before a single lab moves. And you've been washing it down and going back to sleep. Now, number 2 on this list is the quietest of all 6, and by the time it shows up on blood work, the damage is permanent. Every study is waiting for you in the description. Before we start, tell me one thing below. What's your age, and how long have you been waking up dry? I read every comment myself, and I write back. Now let's start with type number 6, the version of dry mouth almost everyone brushes off, and the organ it's actually pointing at. Number 6, medication-induced dry mouth. This is the most common type of dry mouth, and yet it is the one people dismiss the fastest because they assume it is just a normal side effect they have to live with. If you wake up with a dry mouth and you are currently taking any prescription medication, there is a very high chance the medication itself is directly suppressing your salivary glands while you sleep. A comprehensive review published in the journal Drugs and Aging in 2020 found that over 500 commonly prescribed medications list dry mouth as a known side effect. That is not a small number. We are talking about antihistamines, antidepressants, blood pressure medications, diuretics, pain medications, and even some common over-the-counter allergy pills. The study found that patients taking 2 or more of these medications simultaneously had a 40% higher rate of severe xerostomia compared to those on a single medication. What most people do not understand is that these drugs do not just reduce saliva for a few hours. They actually alter the signaling pathways between your brain and your salivary glands over time. A 2019 study in the Journal of Dental Research found that patients on anticholinergic medications for longer than 6 months showed a measurable 31% decrease in baseline saliva production even when they were not actively on the drug. That means the medication was creating a lasting change in gland function. The warning here is straightforward but critical. If your dry mouth started around the same time you began a new medication, or if it has gotten worse since your dosage increased, your body is telling you that the drug is affecting more than just the condition it was prescribed for. It is impacting your oral microbiome, your ability to break down food properly, and your first line of immune defense because saliva contains antimicrobial proteins that protect you from infections. The best approach is to talk to your doctor about adjusting the timing of your medication so you are not taking it right before bed. Taking it earlier in the day can allow the peak drying effect to pass before you sleep. You can also look into saliva-stimulating lozenges that contain xylitol, which a 2021 clinical trial showed increased saliva flow by up to 27% when used 30 minutes before bedtime. Staying hydrated throughout the day matters too, but sipping water right before sleep is not the solution because it does not stimulate actual saliva production. It just temporarily wets the surface. The real fix is working with your prescriber to find the right balance between treating your condition and protecting your oral and systemic health. Now, the next type is one that tricks people into thinking they are just not drinking enough water, but the truth is far more serious. Number 5. Cellular dehydration dry mouth. This type of dry mouth feels identical to regular thirst, which is exactly why it fools almost everyone. You wake up with a parched mouth, you drink a full glass of water, and 20 minutes later your mouth feels dry again. If that cycle sounds familiar, your body is not telling you that you forgot to drink water before bed. It is warning you that your cells are not absorbing water properly, and that is a completely different problem. A 2020 study published in Nutrients found that up to 75% of adults are functioning in a state of chronic mild dehydration. But here is the part nobody talks about. Of that group, roughly 33% were actually drinking the recommended daily amount of water. They were consuming enough fluid, but their cells were not retaining it. This is called cellular or intracellular dehydration, and it happens when your electrolyte balance is off. Your cells need sodium, potassium, and magnesium in the right ratios to pull water across the cell membrane through a process called osmosis. Without that balance, water passes through your system without ever properly hydrating your tissues, including your salivary glands. A clinical study from the European Journal of Clinical Nutrition in 2019 showed that participants who added a balanced electrolyte solution to their water showed a 48% improvement in cellular hydration markers within just 72 hours compared to those who drank plain water alone. The warning your body is giving you with this type of dry mouth is that your mineral balance is off, and that affects far more than just your mouth. Poor cellular hydration is linked to impaired cognitive function, muscle cramps, poor sleep quality, and even increased cortisol production because your adrenal glands need proper hydration to regulate stress hormones effectively. The fix for this is not just drinking more water. In fact, drinking excessive plain water without electrolytes can actually make it worse by diluting the minerals you do have. The most effective approach is to add a pinch of high-quality sea salt and a squeeze of lemon to your water, or use a clean electrolyte supplement that contains sodium, potassium, and magnesium without added sugars. A 2021 trial in the Journal of the International Society of Sports Nutrition found that participants who consumed electrolyte-enhanced water before bed experienced a 36% reduction in morning dry mouth symptoms compared to the plain water group. Drinking the majority of your fluids earlier in the day and finishing with an electrolyte-rich drink about 90 minutes before bed gives your body time to absorb and distribute that water properly. But the next type of dry mouth on our list has nothing to do with what you are drinking at all. Number 4. Acid reflux dry mouth. Most people associate acid reflux with heartburn, that burning sensation in your chest after a heavy meal. But there is a silent version of reflux that millions of people have without ever feeling any burning at all. And one of its primary nighttime symptoms is waking up with a bone-dry mouth. This condition is called laryngopharyngeal reflux, often shortened to LPR, and it is sometimes called silent reflux because it does not produce the classic heartburn symptoms. What happens is that stomach acid travels up your esophagus while you are lying down asleep, reaches the back of your throat, and your body responds by dramatically reducing saliva production in a counterintuitive protective mechanism. A 2020 study in the journal Gastroenterology Research and Practice found that 62% of patients diagnosed with LPR reported chronic dry mouth as their primary complaint, not heartburn or chest discomfort. That is a staggering number. Even more alarming, a 2018 study in the laryngoscope found that patients with untreated LPR were 3.1 times more likely to develop vocal cord damage and chronic throat inflammation compared to those without reflux, and the dry mouth was often the very first detectable symptom. Your body is essentially telling you that acid is reaching places it should never reach, and the warning sign it chose was shutting down saliva flow. The reason this happens specifically at night is gravity. When you lie flat, there is no gravitational force keeping stomach acid where it belongs. so it creeps upward, especially during the later sleep cycles when your lower esophageal sphincter naturally relaxes. The warning here is that silent reflux, if left untreated, can damage your esophageal lining, erode your tooth enamel, and increase your risk of developing a condition called Barrett's esophagus, which is a precancerous change in the tissue. The best way to address this is to stop eating at least 3 hours before bed so your stomach has time to empty. Elevating the head of your bed by about 6 to 8 inches using a wedge pillow has been shown in a 2019 clinical trial in the American Journal of Gastroenterology to reduce nighttime reflux episodes by 52%. Avoiding trigger foods like citrus, tomatoes, caffeine, alcohol, and spicy dishes in the evening also makes a significant difference. Some people benefit from drinking a small amount of alkaline water before bed, as a 2018 study in the Annals of Otology, Rhinology, and Laryngology found that water with a pH of 8.8 deactivated pepsin, the enzyme that causes throat tissue damage. If your dry mouth comes with a sour taste, morning hoarseness, or a feeling of something stuck in your throat, this is very likely your type. And the type coming next is one that many people live with for years before it ever gets properly identified. Number 3. Autoimmune dry mouth. If your dry mouth is persistent, meaning it is there almost every single morning regardless of how much water you drank, what medications you are on, or what you ate the night before, your body may be warning you about an autoimmune condition that specifically attacks moisture-producing glands. The condition is called Sjogren's syndrome, and it is far more common than most people think. The Sjogren's Foundation estimates that roughly 4 million Americans are living with this condition, but the truly alarming statistic is that the average time from symptom onset to diagnosis is nearly 7 years. That means most people suffer with the symptoms for the better part of a decade before anyone connects the dots. A 2021 study published in Rheumatology found that 96% of Sjogren's patients reported dry mouth as their earliest and most persistent symptom, ranking it above even dry eyes and joint pain. What happens with this condition is that your immune system mistakenly identifies your salivary glands and tear glands as threats and begins attacking them with inflammatory cells. Over time, this inflammation damages the glands and reduces their ability to produce saliva. A 2019 study in the journal Arthritis and Rheumatology measured saliva output in Sjogren's patients and found that their unstimulated salivary flow rate was reduced by an average of 71% compared to healthy controls. That is a massive reduction. The warning your body is sending here is that your immune system has gone off track and is actively damaging your own tissue. Sjogren's does not just affect your mouth. It can impact your kidneys, lungs, liver, and nervous system if left unchecked. A 2022 longitudinal study in Annals of the Rheumatic Diseases found that Sjogren's patients had a 15.6 times higher risk of developing lymphoma compared to the general population, making early detection genuinely life-saving. The way to address this starts with getting properly diagnosed through specific blood tests, including anti-SSA and anti-SSB antibodies, along with a salivary gland biopsy if needed. Once diagnosed, treatments focus on stimulating whatever gland function remains using prescription medications like pilocarpine, which a 2020 trial showed increased saliva flow by up to 42% in Sjogren's patients. Using alcohol-free mouthwashes, keeping a humidifier running in your bedroom, and applying vitamin E oil to your lips before sleep can also provide meaningful relief. If your dry mouth comes with dry eyes, persistent fatigue, and joint stiffness, do not ignore that combination. Get tested. Now, the next one is a type that directly ties your mouth to your blood sugar, and the numbers are genuinely eye-opening. Number 2, blood sugar dry mouth. This is the type that catches people completely off guard because they feel healthy in every other way, yet their body is silently struggling to manage blood sugar levels, and the first place it shows up is in their mouth every single morning. Persistent dry mouth is one of the earliest and most overlooked symptoms of both prediabetes and type 2 diabetes. A 2021 study in the journal Diabetes Care revealed that dry mouth was present in 76% of individuals with undiagnosed type 2 diabetes and in 34% of those with prediabetes. The mechanism is straightforward once you understand it. When your blood sugar is elevated, your kidneys work overtime to filter out the excess glucose, pulling more water from your body in the process. This leads to increased urination, which dehydrates you, which directly reduces the fluid available for saliva production. But it goes even deeper than simple fluid loss. High blood sugar also damages the small blood vessels that supply your salivary glands, a process called diabetic microangiopathy. A 2020 study in the Journal of Diabetes Investigation found that diabetic patients had a 29% reduction in salivary gland blood flow compared to non-diabetic individuals, and this reduction correlated directly with their average blood sugar levels over the preceding 3 months. That means the drier your mouth is, the worse your blood sugar control has potentially been. The warning here is urgent. Undiagnosed diabetes does not just cause dry mouth. It silently damages your kidneys, your eyes, your nerves, and your cardiovascular system. A 2019 meta-analysis in The Lancet found that the average person with type 2 diabetes has had the condition for 4 to 7 years before receiving a formal diagnosis. During that entire time, damage is accumulating. Your dry mouth might be the earliest clue your body is offering you. The first step is getting a simple blood test. Specifically, ask your doctor for a fasting glucose test and an HbA1c test, which measures your average blood sugar over the past 2 to 3 months. An HbA1c between 5.7% and 6.4% indicates prediabetes, while 6.5% or higher indicates diabetes. Addressing blood sugar through diet is the most powerful tool available to you. Reducing refined carbohydrates and added sugars, increasing fiber intake, and incorporating regular moderate exercise like walking for 30 minutes after meals can dramatically improve your numbers. A 2022 study in Diabetologia showed that participants who walked for just 15 minutes after each meal reduced their post-meal blood sugar spikes by 38%. If your dry mouth comes with increased thirst during the day, frequent urination, especially at night, unexplained fatigue, or blurry vision, get your blood sugar checked this week. And now we arrive at number 1, the type that shocked researchers because of its connection to a life-threatening condition hiding in your sleep. Number 1, sleep apnea dry mouth. This is the type of dry mouth that concerns doctors the most, and it is the one with the most dangerous consequences if ignored. If you consistently wake up with a severely dry mouth, especially with a raw or sore throat, your body may be warning you that you are repeatedly stopping breathing during sleep. The condition is called obstructive sleep apnea, and it affects an estimated 936 million people worldwide, according to a 2019 report in The Lancet Respiratory Medicine. What makes it so dangerous is that roughly 80% of moderate to severe cases remain completely undiagnosed. Here is the connection. During a sleep apnea episode, your airway becomes partially or completely blocked, and your body instinctively opens your mouth to gasp for air. This chronic mouth breathing throughout the night dries out your oral tissues completely. A 2020 study in the journal Sleep and Breathing found that 78% of patients diagnosed with obstructive sleep apnea reported dry mouth as one of their top 3 symptoms, and those who breathed through their mouth during sleep had saliva flow rates 67% lower than nasal breathers. But the dry mouth is not the real danger. The real danger is what sleep apnea does to your heart and brain every single night you leave it untreated. A landmark 2021 study in the European Heart Journal found that individuals with untreated moderate to severe sleep apnea had a 140% increased risk of cardiovascular events, including heart attack, stroke, and heart failure, compared to those without the condition. Every time you stop breathing, your blood oxygen drops, your body floods with stress hormones like cortisol and adrenaline, and your blood pressure spikes. This happens dozens or even hundreds of times per night. A 2022 study in the American Journal of Respiratory and Critical Care Medicine found that severe sleep apnea patients experienced an average of 47 breathing interruptions per hour, meaning their body was entering a state of emergency roughly once every 75 seconds throughout the entire night. The warning your body is sending you through that dry mouth could not be more urgent. Your brain is being starved of oxygen repeatedly, and your cardiovascular system is under enormous stress. If you suspect this might be you, the gold standard for diagnosis is a sleep study called a polysomnography, which can now be done at home with portable devices your doctor can prescribe. Treatment typically involves a CPAP machine, which a 2021 meta-analysis in JAMA showed reduced cardiovascular event risk by 36% and improved daytime alertness by 44% within just 3 months of consistent use. Maintaining a healthy weight also plays a major role because a 2020 study in the journal Obesity found that a 10% reduction in body weight reduced sleep apnea severity by an average of 50%. Sleeping on your side instead of your back, avoiding alcohol within 4 hours of bedtime, and keeping your nasal passages clear with saline rinses can all reduce episodes. If your morning dry mouth comes with loud snoring, gasping during sleep, morning headaches, or extreme daytime sleepiness despite sleeping 7 or 8 hours, please take this seriously and talk to your doctor as soon as possible. So there you have it. 6 very different types of dry mouth, and the 6 very different warnings your body is trying to send you. From medication side effects all the way to a potentially life-threatening breathing disorder, that morning dryness is never just about needing a glass of water. Your body communicates with you constantly, and learning to read its signals is one of the most powerful things you can do for your long-term health. Do not ignore what your mouth is telling you every morning. Pay attention to the pattern, notice what other symptoms come with it, and bring that information to your doctor. It could be the conversation that catches something early and changes everything. If this video helped you understand something new about your health, hit that subscribe button so you do not miss the next one. Thank you so much for watching.